September is Suicide Awareness Month. Suicide's a worldwide public health crisis. In the United States, it's the 12th leading cause of death in adults and one of the leading causes of death for people ages 15 to 24. Here today to talk about some myths surrounding suicide is Dr. Stevan Lahr from Family and Children's Services. Dr. Lahr, thank you so much for being here. It's an important topic, not a fun topic, but it's an important one. So we're going to talk about each myth, and then you kind of talk about each one. So the first one is this, that all people who die by suicide have a mental illness.
Right, so that's a myth. Statistically, less than half of the people who actually complete suicide have a mental illness. Depression, substance use does increase your likelihood or put you at higher risk having thoughts of suicide, but so does having chronic illness, chronic pain, and then relationship and financial problems also can increase your risk of thoughts of suicide. Kind of theme here is that there's a loss of hope, okay, and a feeling of being trapped. So it's not only mental illness that causes thoughts of suicide.
Yep. The next myth that we have is asking about suicide can cause a person to hurt themselves.
Right, that's not correct. So talking about suicide does not cause suicide. In fact, it does the opposite. It really helps. So being able to talk about something that's just so painful really lets a lot of pressure out of the situation. Talking about suicide can save lives. I know it can be very uncomfortable. So just three kind of quick tips on talking about suicide. So the first one would be to really listen, okay? Let the person have space to talk about what's going on, and then let them know that they're not alone. Okay. The next tip would be never keep it a secret. Okay, thoughts of suicide is nothing to be ashamed about. It's a symptom that our brain needs help. And the third is to partner with them on how can we get you help and how can we keep you safe. That could be making sure they make an appointment or maybe contacting a crisis line or a crisis center with them.
And don't be afraid to ask someone about that, right?
Exactly.
Okay. And then here's our last myth today. Suicidal thoughts are not treatable.
Right, so thoughts of suicide are definitely treatable. Not only are they treatable, but there are lots of different treatments for them. Most thoughts of suicide go away quickly with intervention or treatment. I think the most important thing to remember here is that there's always someone out there that is available to talk. So if you're feeling or having thoughts of suicide, reach out and talk to someone. You can call us at Family and Children's Services COPES 744-4800, or you can call the new crisis line 988. There's always someone there to listen for you.
And a lot of times these are temporary feelings, right?
Right. So most thoughts of suicide resolve in about 24 hours, and survivors of suicide will say that almost immediately after the attempt, they started regretting their decision.
Yeah, permanent decision for a temporary emotion. All right. Dr. Lahr, thank you so much. And we do want to mention that if you or anyone you know needs help, we have a list of resources on your screen right now for all of your help. Dr. Lahr, thanks again for joining us.